Everyone's talking about longevity, but few people can articulate what it actually means to them. Is it adding years? Is it optimizing the last decade? Preventing disease? Today's guest bridges medicine, psychology, and longevity science, and she's learned that this question matters more than most protocols.
And she's learned that the gap between knowing what to do and actually doing it is where most health interventions fail. So perfect protocols don't really matter if people can't stick to them. So today we explore what actually works in practice.
We'll cover how she assesses longevity through biomarkers, her research on functional foods like fermented buckwheat and fiber blends, and why metabolic health might be the most underrated pillar of health span optimization.
And we'll dig into the hard questions as well. So where does the evidence for longevity interventions actually stand? What's the difference between food is medicine and food is marketing? And what to do when someone's life circumstances work against their health goals.
Dr. Rhea Kotecha is a longevity physician with training in medicine, nutrition, psychology, and a background in functional food research. She works with clients on metabolic health and health span optimization using biomarkers and data to create personalized intervention protocols and build health that lasts.
She also writes a newsletter that looks at longevity through an anthropological lens. So asking questions about movement, behavior, and what we've lost in how we think about health. So let's find out what she's learned.
Dr. Rhea, you have a fascinating background. You're a medical doctor who practiced in the NHS, but you also studied psychology and nutrition as additional degrees. Walk us through that journey. What was the moment you realized you wanted to work at this intersection of disciplines?
Thank you for having me today, Miguel. I'm looking forward to chatting with you. So everything sort of changed with me is the first seed was really planted in COVID medicine. I was working in the NHS and people were very acutely unwell. It just felt that it was just very reactive medicine. We were just handed a list of patients and had to deal with them. And it just felt like we weren't really looking at why they were actually vulnerable. We used age as a proxy for risk, which I felt was quite poor because you'd see people in their 70s that seemed to be quite a bit more resilient than people that were younger than them. So it made me a little bit confused at the approach that we were using in modern medicine. But the biggest change actually happened for me when I became a mother. And I actually had a young daughter who developed a very severe feeding aversion. She was in and out of hospital and we had all these protocols about just calories in. Everything was reduced to spreadsheets. How many fluid intake is she taking? Calories. And it just sort of humanized the whole process for me and made me question modern medicine. What is actually happening? Why is this going on with her? And we can't just look at everything in a very data-driven way. We have to look at the whole picture. It was a very personal experience for me, but it also made me realize that I wanted to change my career trajectory. I didn't want to focus just on endpoints. I wanted to focus on cultivating health from the very beginning.
That's amazing. That's an amazing approach. And I think way more doctors or physicians should take this approach. And also in terms of education, I think also in medical school, this specific type of thinking should be taught way more. Way more emphasis should be put onto this specific topic. So like in terms of your background, you're crossing nutrition, psychology, medicine in general. Like for me, I mean, if we look at the broad picture, if we look at 2026, the state of psychology is really bad. I mean, anxiety disorders is on the rise, depression is on the rise, all of those psychological related diseases are on the rise. So I was really wondering, like, what did the knowledge of psychology teach you about longevity that, for example, your background in medicine and nutrition science couldn't?
So with medicine and nutrition science, you have perfect protocols and textbooks telling you that this should work, right? But it doesn't tell you the context the person is coming from. What is not just their motivation, but what is their capacity? Are they very overwhelmed with stress? Do they not have the right environment to put these changes in, whether it's a nutritional change, whether it's an exercise change? And I think you need to take a step back. Instead of designing the perfect protocol for them, you actually find a protocol to treat their lives with them and understand, look, okay, your VO2 max is really poor at the moment. Can we boost this? And the person might say, honestly, I'm not ready to do any change in my exercise, but I'm ready to change my diet. And even if you make that 5% change, but you're trying to sort of work with that person, not shame them when they can't follow things, because let's be honest, none of us are perfect, right? We all have problems. Even if we know the science, we're not doing everything 100%. And, sort of just understanding that human relationship, understanding what people can do in their environment. I think that's really important.
Yeah, I can 100% agree on this. The real problem is for most people is adhering to the protocols like someone is giving them, and most people already have way too much information and don't really know what to do. So to really cut through this noise is extremely important, and we'll definitely talk about this specific thing about adhering to a specific protocol later on as well. For now, I want to really dive into a different topic as well, which I, for example, on LinkedIn also post about a lot, is this differentiation between marketing and really something which is valuable. And on your Instagram, for example, you talk a lot about functional foods. So I was wondering, is like this term functional foods, is it just marketing speak for what food like used to be before we pretty much industrialized it? Or is there actually something like novel which came out of research or anything like that here that extends health span?
That's a really valuable question. And I think it can be a little bit of both, to be honest. When you just take foods and you strip them down and industrialize them and put these big marketing claims on as this perfect, amazing food, it can be just a marketing claim. When we think back on the foods that have really helped and healed our grandparents, they didn't talk about the inositols and buckwheat helping with blood sugar balance. They didn't talk about the pectin in apple being really good for gut barrier integrity. But there are some amazing functional foods out there. And once you learn how to integrate them within your lifestyle, you do see clinical improvements. But if somebody labels something a functional food, a special food, but they can't tell me the physiology behind why that is, then I think it's marketing. So I think that's the best way to sort of differentiate.
It's interesting that you make that distinction, that you show how maybe the same thing used to be viewed very differently in previous decades, but also this can be a chance, right? Motivating people through information and giving them context of why they should maybe implement healthier behaviors that maybe before was not even necessary because that was what people only had access to. But now with all the other probably way more unhealthy things people have access to, just rearranging the focus and showing it makes sense to do X, Y, Z because it has this positive impact on our physiology. That may be a very interesting thing to do, actually, from both a marketing lens, but also from a lens of where can we actually get the best outcomes, and that may be the 1,000 decisions people make every day. So I really like the way you viewed that. Just maybe zooming out a little bit more, because maybe if it's nutrition or any other thing, it's part of a general optimization protocol. And this is also the sort of clients you see, right? People come to you because they want to live healthier for longer. They want to optimize their health span and longevity. And maybe if you could walk us through, how do you actually assess where someone is in their longevity journey, and how do you approach that doctor-client relationship?
First thing is to actually treat somebody as a human and not just as a protocol and not just look at the numbers. It's really understanding where they're sitting on their trajectory. Of course, understanding the risk factors and through biomarkers, but sort of understanding what are they ready for. Some people can't take this massive information overload. It becomes quite paralyzing, and then they feel, oh my gosh, my biological age is 10 years older and this and this and this. And it sort of drives adherence in the opposite direction. So I think it's really important to sit down and understand, okay, what are your daily habits? What are you willing to change right now? What's important to you? What do you view on longevity? What does longevity mean for you? And understanding what their definition is almost definitely different from what mine is. And sort of we come to a partnership, I like to feel that, can I suggest this? Would you agree to doing this? And then we sort of build a protocol like that, because everybody needs to be individualized, right? If you have just the same protocol for everybody, it's going to fail because everybody's so different. Personalities are different, but lifestyles and environments are significantly different.
Yeah, I really love this approach of individualized medicine, looking at every person as themselves, because everyone is different, as you mentioned. And then also, like, just a quick anecdote, when, for example, some people ask on LinkedIn, on social media in general, if AI can replace doctors in like maybe 10 or 15 years, I always think about like that we need this human connection for this like individualization, and also to just talk to them and to just be there to speak about their past and speak about what they really want to do, what they can achieve. And for this, I don't think like AI has any future. And that's like the main part where we need doctors to really look at the person, to talk to them. This is an amazing approach. You talked about biomarkers. You just mentioned them. So let's dive a bit deeper here. Like, for example, blood work or microbiome testing, all of this. So can you walk us through the hierarchy? Like, which biomarkers are non-negotiables for longevity assessments and which ones are just, let's say, nice to have?
So ideally, I'd love to test everything because the more data I have, the more individualized I can be. But as I mentioned, too much information can also be paralyzing. And also there is a cost element associated with so many of these tests. Some people, a lot of the clients that come to me don't come from a very scientific background. They've not been to previous longevity clinics and they kind of heard the buzzword longevity. What can you do for me? And if I just put everything on them, they're firstly going to say it's too expensive. I can't do it. And then it's too much to sort of absorb. In terms of non-negotiables, we need to do advanced blood work. So we want to look at, specific cardiometabolic markers and things like that. I need a body composition scan. I need to know what's going on there, and a VO2 max. So those three are my preliminaries. I can't do without them. I'd love to have epigenetic data and I'd love to have microbiome data, but sometimes it just means getting that person's foot in the door, making that 5% change and developing that relationship with them. They can trust you. Then they know, okay, this is putting me in the right trajectory. I'm ready to take on more. And I often see that people only do the baseline and then they say, okay, let's start with something else. Let's try something else. It'd be great to do everything, but there are limiting factors, unfortunately.
Yeah, that's totally right. I imagine that some people, though, they approach you with things they have heard on social media, certain hype topics, whether they ask for NAD plus IVs or other things. But knowing you put the focus at the beginning on different topics, right? So metabolic flexibility. Why do you think metabolic health is so fundamental to HealthSpan? And how do you make your clients understand that this is the thing they have to start with before thinking about, let's say, very advanced, maybe also more experimental approaches?
Mm. I think that's a great question, Miguel. That's something I do battle with quite often. I'll get somebody who comes in with a perfect fasting glucose and a great HbA1c. And I'll say, we need to look at your metabolic markers a little bit more. You've got a really high fasting insulin. And it takes a while for them to sort of grapple that there's some dysregulation in blood sugar balance. But I take some time to go through this with them because it is super important. And I think that when we think about the 4 chronic diseases that related to age-related diseases, as Dr. Kotecha calls them, the horsemen of aging, cardiovascular disease, type 2 diabetes, cancer, and neurodegenerative disease. This all stems from metabolic inflexibility, right? There's so many hallmarks of aging, from things like loss of proteostasis, advanced glycation, that all happens when you have a dysregulation in the way your body manages blood glucose. So I think it's so fundamental to fix that. It's like IV and AD and of course, there's a lot of promising science coming out, but if you have a lack of metabolic flexibility, there's not so much these drips are going to do, right? You need to fix that base first before you start layering things on top of that. So a lot of people come to me quite disappointed because they're hoping for this futuristic thing. They're hoping for me to tell them something really cool that no other doctors told them. And I'm giving this boring stuff like, you need to balance your blood sugar. That's the first thing we need to treat. I do get a lot of disappointment, but I think it's important to lay that fundamental down.
Yeah, I mean, I personally couldn't agree more. And that's also a thing I talk about often online. It's the thing that most people want this miracle cure. They just want to take, I don't know, like 50 different pills or maybe even just one pill. And with this one pill, they pretty much want to fix everything. And they want to improve their health span, want to improve their lifespan, want to make sure that all of their problems are solved. And that's just not really how it works. Like, first of all, you need, as you said, you need to be sure that you have a solid baseline. And on top of this baseline, you can maybe do different stuff, which is maybe more experimental or more advanced or something like this. But without this baseline, it doesn't really make any sense. So I really love your emphasis on this. Like, one question ago, you already mentioned like that you would love to see some microbiome data, microbiome testing. So I was always wondering, I also did that myself already, microbiome testing, and there's so much data you can already get right now. But the question I always have with this is like, if we are already at the point of it, so the microbiome testing, that it is a valuable diagnostic tool that specifically also allows for like clinical decision making, or if it's right now just a bit too much data still and not enough evidence. So like, what's your line there? What's your opinion?
I think it's a really valuable question. And I think we first need to look at the different types of microbiome testing. So we have so much out there in the market. We've got things like shotgun DNA analysis, then we've got RNA-based technologies. So we get such a different output from so many different tests. And unfortunately, we don't have a gold standard at the moment. It's not like running a simple lipid panel where you know what you're getting, you know how to treat it. We have protocols. So it's a very early science, but I do think it's a very promising science. And I personally feel like I get a lot of clinical data from it. I do get a lot of patients coming to me saying, I spent 50 quid on this one test and I got all this data. Why is your test so much more expensive? And I have to explain to them that there's not much sense if you're just getting output of data. You need to get stuff that's actually clinically actionable. Are you looking at percentage diversity, or are you just looking at a bunch of different species, which is very important. And then I think once you have that information, you can actually start to treat. You can see whether is there a massive overgrowth of LPS producing species that's causing inflammation. Do you have reduced short chain fatty acid producers? When you see those sort of overall things, it may not be a perfect science because we don't know the reproducibility so well at the moment. But if you start to make those dietary changes in line of what you've found, and then you do the retesting and you see improvements there, I think that's quite positive as a positive feedback loop for both clinician and for client. And I mean, if you ask me this question in 5 years, I'm sure we'll have so much more information and we'll have like great protocols then, which I'm really excited about. But I do think it is clinically actionable, and I do think we do get a lot of great information from them.
It's so interesting what you're saying, because I've also done microbiome testing, and it's certainly more than 50 quid to do it. And so it's certainly something that you think about in advance. It's like, okay, if I'm spending this much money, what's really the takeaway? And to be honest, for myself, it was pretty underwhelming what came out of it, because it was at that point not really clear what to do with it. If you look at all the patients you've seen and where you have conducted microbiome testing with, what would you say are like the top 3 biggest red flags you've seen in their tests? Is it something more related to gut barrier integrity? Is it something more related to strains that are producing LPS that are causing issues, or too little of good strains? Is it Akkermansia? What are the things that you see, okay, from all the patients I've seen, this is what people should put more emphasis on?
I think it's a bit difficult to answer because there's so much that we get from this data, right? So if you do see, I do two different microbiome tests. One is a GI map where we're looking at gut barrier integrity. So we've got markers like zonulin, secretory IgA, looking at viruses, fungi, protozoa. Then I do a general longevity microbiome with my virtual clients where we're looking at percentage diversity. But we're just looking more for optimization and longevity. We're not looking to really treat functional issues. But it's different kind of based on what the person's symptoms are and what data you get. I mean, in terms of serious red flags, if there is a lot of LPS burden, we do need to think about how do we want to approach this? Is it like a monoculture? Is one just thriving when the others aren't? And does that mean that we need to kill off that bacterium? Or does it mean we need to change the environment? Do we need to change the terrain in where it's growing with things like fermented foods, different things like that, not just giving a standard probiotic? I think adding foods and adding all of that brings a big nuance to, fixing all of this. So it's a bit confusing to say which is the specific things to look at. I think you need to really match the symptoms with what you're finding, and then you can really go ahead with what's the most concerning and what do I need to fix now.
Yeah. Interesting. Yeah. So you've also mentioned that depending on whether people are struggling with issues, and then you try maybe more of a functional approach, or if people come to you because they're pretty much fine, but they want to optimize their longevity and health span, and then you take maybe a little bit of a different approach. And that's also another question I had is if someone comes to you for longevity or health span optimization and they're in their 30s, how do you make them visualize and incentivize certain behaviors that will only really show when they're 70? So having this very long-term thinking, how do you approach that?
So this is a really fun part for me because I've actually created 2 sort of exercises, 2 games. One, I call the marginal decade exercise. The other one is plot your longevity timeline. So the marginal decade exercise is basically I came up with 150 different activities to do in your marginal decade. I've split them into different domains: cognitive, like reading a book, having a meaningful conversation; physical, walking 5,000 steps a day or working 10,000 steps a day or being able to travel independently; and then social stuff as well. So I send it to them the day before they come in. in and I tell them to take a look, read through all of this. What 10 things out of this list, I'm sure you want to do all of them, but what 10 things in this list do you want to be able to do? And it's quite interesting because it makes people start thinking about that final decade. It makes them start thinking, oh, I always thought I could travel on my own, or I could always read a book. Why would I not be able to read a full book? So it already puts them in that mindset. Then when they come in, we do plot the lifelines. Longevity timeline exercise is basically I plot your lifespan and then we'll plot your health span. Then we'll see where is it going to dip. Is it dipping at 60? Is it dipping at 70? And what's making those things dip? What do you hope for and what do you believe is going to actually happen? Then we add the next layer onto that. Like, what do you want to be functionally doing in these decades? And then when it really comes to life is when we actually plot the kids' ages and then plot the grandkids, the future grandkids. Then it's like actually visualizing this. And I had a really, really powerful moment with a client a few weeks ago. She's had high ApoB for years, really high LDL, and all the doctors have told her to go on statins. And she says, I've come to you because I only want a lifestyle approach. So we plotted everything. And in her final decade, she closed her eyes and her manifestation was that she was attending her granddaughter's wedding. She was wearing her beautiful Indian lehenga. She was wearing her lovely jewelry. She had some white in her hair, but she didn't have a walking stick. And she was dancing a little bit. She had a little bit of scotch, but she was a bit tired and it's like a really beautiful moment. And she's like, oh gosh, I can't imagine when my granddaughter gets married. She's just been born. And I said, isn't that such a great visual? So I want to explain to you what the risk of not treating cardiovascular disease is right now. So for you, it could rob your independence. If you develop a stroke, you might have to be in that wheelchair, not just a walking stick. You think about this beautiful image you have and what can we do to send you there? And then she sort of just changed her mind and she said, okay, let's start treatment. But I think it's really amazing because you see this shift, especially in younger clients in their 30s. They're coming in because they want extra gains, like, oh, I want to look a little bit better. I just want to feel a bit better. But they don't really think about what longevity really is. And once you start thinking about that final decade and, what's so important to you then? You want to be completely mobile, but you don't exercise at all now. How is that possible? I just asked that question. And then people start thinking, oh, wow, okay, fine.
That is such an amazing approach. I really need to make sure that I really give this enough credit because I love this approach. And I think love is the perfect word for this. Not like only in terms of like that this approach makes a ton of sense. This also, I think, also because of that you are mapping your grandchildren and your children, this gives so much motivation and like such a big goal to work towards that people are actually, I guess at least, willing to make the changes they need to make because they have this grand vision of them. Like, for example, being at the wedding of their grandchildren. This is such an amazing goal and this gives so much motivation. Like, really want to say that this approach is extremely amazing. Now let's dive a bit deeper into one of your topics at heart, which you're also talking about often on your Instagram, for example, which is fermented buckwheat. So, like, first of all, can you quickly explain like what is fermented buckwheat? Where's it coming from?
So what was quite cool with the study is I can't really explain the lab conditions under it was, but basically it's a buckwheat beverage. You take buckwheat groats and you ferment it under lab conditions under a specific approach where you need to make sure you're not getting too much phytic acid. Then you get this slurry, you remove all the carbohydrate particles from it. So what's left is a lot of the mineral density, the protein, the inositol, the flavanols. You get this liquid. Then you dehydrate that into a powder. And that powder is so metabolically powerful. So what the study did was it matched it against we did an OGTT on the study with people just took a sugar beverage and water, and then they took the sugar beverage with this buckwheat, dehydrated buckwheat that was reconstituted into a drink. And what we found was that
sorry to interrupt. Can you maybe quickly explain what an OGTT is regularly and for what do you use it for?
Okay. So with oral glucose tolerance test, it's to see how your body manages postprandial glucose. So what it is you ingest a carbohydrate load and you have blood samples drawn quite frequently to see how does the curve go up and come down. And it's really helpful to see that term of metabolic flexibility.
Thank you. Just to make sure that everyone of the listeners can also follow what the difference then is with fermented buckwheat.
So with the fermented buckwheat, we had a 43% flattening of that curve, which is really incredible because when you think about pharmacological approaches to diabetes, a lot of them miss this. Metformin is a great insulin sensitizer, but it doesn't do much for postprandial glucose. Of course, the GLP-1s work really well on this, but they can be really expensive and there's other side effects as well. So being able to get this from a whole food is really incredible. And what I think the most powerful thing, what I learned with this was actually when you start to develop metabolic inflexibility, it doesn't show up with a fasting glucose that's raised. It shows up with postprandial glucose dysfunction. So it means that your body isn't managing the way you're eating meals. So that's the first sort of sign. And once you find that before you develop elevated fasting glucose, before you've had years of high blood glucose and glycemic changes, glycation, loss of proteostasis, inflammation, you can target it from the very beginning. And I think that's really, really powerful in terms of longevity medicine, because it's often not discussed, it's often not looked at, but it is the first factor that starts showing that change.
So interesting that the fermented buckwheat has such an impact. And I mean, there's also, maybe people are not too familiar with fermented buckwheat specifically, but they for sure have heard about the health benefits of fermented foods, generally speaking, whether that be kombucha or kimchi or whatever it may be that they see in the supermarket that is advertised heavily as having XYZ health benefits for gut health, immunity, and so on and so forth. Walking through the supermarket aisles, see all these supposed benefits. How do we differentiate between the legitimate health span benefits of these things and just like the wellness trend and marketing hype?
I think it's an interesting question. It's quite nuanced because there is a lot of wellness hype around it. But if you look at the actual data, there's a lot of evidence that shows that ingesting fermented foods is so great for microbiome diversity, gut barrier function. And if you actually take a step back, it may actually potentially be the number one dietary intervention to help improve that. So the thing that I love so much about fermented foods is it's not just the wellness hype is it's adding good bacteria. And of course it is, but more than that, it's changing the terrain of the gut. So when our grandparents or great-grandparents used to ferment foods, it's because there wasn't any refrigeration. There were so many beneficial factors to that because it would acidify the gut. It would change the way microbes would grow. And I think that's something that gets lost a lot in translation and it doesn't get translated in the wellness sense because you think about what's happening right now. There's so much SIBO, so much IBS, so many of these problems. And it's not that we're ingesting radically different microbes than our ancestors did. But our terrain is very different. Ultra-processed foods, inflammation. So it's showing that different things are growing in different proportions. That's not that beneficial. A lot of people just want to go for a probiotic, but they don't change their diet. And, if you've got so much inflammation, probiotic is only like a drop in the water because that doesn't have a good environment for it to grow. But when you're eating fermented foods, and the recommendation is to eat 3 fermented foods a day, which is challenging to do, but it's quite amazing when you start to see what happens. You're changing that terrain. You're not allowing this dysbiosis to happen as much. And, you'll have somebody who's got IBS or SIBO, you treat that, they feel better, but it just comes back again. Why? Because you're not changing that terrain. So I think fermented foods are quite wonderful, not just a hype.
Yeah, I agree. I agree totally. I also eat I don't really eat 3 different types of fermented foods a day because, as you said, I think it's pretty hard to do, to be honest. I try to eat 1 or 2 and I most of the time stick to it, but 3 is, pretty hard. We saw that you've also developed your own fiber and protein blend. So just quickly walk us through this. What makes this different? Why did you do it? What was the reasoning behind this?
So the reasoning was in clinical practice, I see so many people who drastically undereat fiber and drastically undereat protein. And in terms of fiber, it's really difficult for somebody to hit that 30 to 40 gram goal. I mean, if you think about 40 grams of fiber, that's like 2 heads of broccoli or 8 cups of blueberries. So it's quite challenging to do when people are really busy, rest, skipping meals. And when you look at the other fiber supplements that are out there, then usually just one type of fiber, 5 grams, flavored orange flavor, a little bit processed. And that doesn't give you that much benefit, as opposed to what I've done with my blend is I've included a lot of different fibers, like things like acacia root and green banana that really works on things like short chain fatty acid producers. So you're really working on the whole ecosystem. It's not a replacement for vegetables, but it's a way to boost it. It's a daily whole food blend to boost it. With the protein, I saw a different challenge. Everybody loves their whey isolates and their vegan isolates. But when you think about how they're made, for example, back in the day, dairy farms had to pay people to take away the whey because it was a waste product. Now they've realized they can commercialize it, they can sell it. And you think about how industrially that's stripped down to a powder and then you give it to somebody. I see so many people who say, yeah, I take it after my workout because I have to go to the loo straight away. And do you really think this is helpful for you in terms of an information point of view? The modern industrialization is just like to get that 20, 30 gram target, but your body doesn't recognize that 30 grams on the label. It recognizes real whole food matrix. It has to be attached to fats, to texture, to minerals. And that's what's so important. And so the blend I've created is completely whole food based. Doesn't have as high as your whey protein does, but it's so beneficial in terms of inflammation, and it's an easy thing to just add into your daily life.
How can people, first of all, what exactly is that blend composed of, or how can people, if they're at home now and they now have heard, okay, Dr. Rhea, she knows a lot. She told me, okay, that probably not the best idea to do it the way I've been doing it so far with the whey protein. What can they do at home to, let's say, elevate their, let's say, post-gym protein shake a bit further?
Well, I think the most important thing is to take a whole food approach, honestly. And, eating your protein, chewing your protein, that's the most important thing, eating real whole foods and not just thinking about target numbers, but thinking about, society as a whole, pair that with fiber, have proper meals. If you actually eat like a proper breakfast, lunch and dinner, looking at all different food groups, balancing all micro and macronutrients, you do tend to feel that people get full and they do tend to make muscle quite well and they don't have to supplement with all these different things. In terms of what's in my blend, it can't exactly be done at home because I do a couple of tricks to sort of dehydrate and press out a little bit of fat to increase a little bit of the protein. But I use pumpkin seeds, sesame seeds, raw cacao. I use buckwheat in this too because I feel like it's so great. Yeah, sunflower seeds too. So it's quite a nice, helpful blend. It's all targets all amino acids and it gives a good fat profile too, which is great.
So interesting. This just shows again that there's so many layers to it. At first, it's maybe making people aware, okay, there's certain subcategories of food, and then within food you have protein, you have fiber, you have carbs, you have fats, and then later on you're like, okay, you need to have a certain amount of each, but then it also matters how you combine it. And so I think it's great that people can always kind of take a step back, look at their diet and see, given the new information I have, what can I do now to further improve my diet? And I think it's great if through people like you, who are absolute experts in the field, people can then make better decisions every day. So I think that it's great. And I think it really starts with education and having access to these sorts of information. But now also maybe the question in terms of the information people receive and how they implement it. Looking at your longevity clients, for example, what would you say, what's the percentage of clients that actually succeed with their protocols? And maybe also more importantly, the ones that don't succeed, why do their protocols or why do they fail implementing the protocols?
Yeah, it's a very honest question. And I'll start by saying that actually when I first got into the longevity space, I was so excited to look after everybody. Parents, relatives, friends. I said, everybody come to me, I can optimize you. And I took on a lot of clients that weren't ready. And then they felt pushed and then they had failed protocols. And what I slowly learned is a lot of people aren't ready for this and they need to be receptive. They need to come to you. So I kind of don't sell longevity as a service anymore. But it comes to me now, I actually question them and say, what are your motives? Do you think this is like a gut cleanse, like a viral gut cleanse, or you're going to lose 10 kilos in the next 3 months? I'm not giving you interventions for the next 3 months. I'm giving you a longevity blueprint for your life. These are things that are small, unsexy, big changes is not going to happen, just small, consistent things that you can do every day. This is a prescription for your life. Are you willing to change forever? And a lot of them are saying, no, I'll think about it and come back. And I think that's been really good because I've lost a lot of clients, but at the same time,
this is how you filter out, right?
It's been a better use of my time and a better use of the client's time because there's no point in spending the money on testing and getting this program where you just don't really feel like you want to do. So since I've changed that approach, I've seen a lot more improvements and I do feel like people are managing to hit their targets a lot better.
Yeah, this is such an honest approach as well. So I really think this is really beneficial to everybody, to you, to your time, but also to your clients. Because if they are not ready, if they don't adhere to the protocols, that's a huge problem. They're just wasting money, as you said. So like, as adherence is such an important factor and such a big problem in terms of all those longevity interventions, this basics like going to the gym, doing cardiovascular exercise, sleeping well, all of this, like what should medical school teach physicians in order for them to help them to increase adherence for all of the protocols they are giving to their clients? Like, what should be the education needed here to just improve this? Because this is such a huge issue.
I think it starts with actually just getting the information yourself in medical school. I wasn't taught anything about how important exercise is. I wasn't taught anything about nutrition at all. I actually have a mum who comes from a more natural sort of background. She's into, Ayurveda and homeopathy. And she used to tell me all these things about different foods and different approaches to things. And I thought she was just talking nonsense. And it had to take a lot to change in my life to understand that you need to think about everything in a holistic way. I think that's the first change. Then when it comes to changes in adherence, I think putting too much pressure on somebody is a bit challenging, when they feel that they're going to be judged by you. And a lot of people feel judged by clinicians, so they don't open up to explaining why things went wrong. It's not that it's a lack of motivation, it's a lack of capacity. If that person is very overwhelmed with stress, if, they've just been so worked up, they didn't have the time to cook properly, they didn't have the time to do this, they didn't have the time to go to the gym, they feel like they've failed. And they haven't. It's just been that the environment hasn't supported it. So you take a step back and you ask, why didn't that happen? Not in a judgmental way, but why? And what can we tweak to make it 5% better next time? Because at the end of the day, none of us are perfect. I'm not perfect with my longevity regime, and I'm sure most people aren't, right? We all make mistakes. We all falter in achieving the perfect targets because it's real life and things come in the way. Just being a little bit genuinely gentler with people, I think helps with adherence because they feel that they can trust you and be honest. And, next time we'll try something different, not just the same approach.
It's so interesting that you, first of all, mentioned that these things and the concepts themselves should be taught at medical school, and that's kind of the foundation. And then later on, also how people can kind of talk to their clients and bring the message across. And I think that's also for sure where your psychology background really helped you, having a better understanding of human behavior and also the impacts of things such as stress, which stress then tanks results. And you've mentioned that, things are not perfect and no one is, and we all make mistakes, especially if life comes in between. My question is, aside, there's this one scenario where, people are trying to implement certain things and it works sometimes or sometimes not. But there is room for the things for the people to be able to implement them. But what about a client or a group of clients who have, let's say, extremely demanding jobs, like people working in big tech? If they come to you for longevity health span optimization, but their lives are fundamentally incompatible with the changes you're recommending, how do you approach this?
I think it's so important to look at them and look at their life. And instead of just looking at their biomarkers and saying, VO2 max in the very poor category, do you know that that's the number one biomarker for longevity? You ask them, what are you able to do today? What does your life permit? And what are you willing to do? I had a client recently who had a very poor VO2 max, and he was in a very high intense financial background. And I said to him, is something we can work on? And he said, honestly, I'm not going to do anything regarding exercise. I want to work on my diet. So I said, okay, that's fine. Let's make that first change. Whatever you can implement, even if it's a 5% change. Of course, I aim for better than 5% improvement in results, but any 1% change, honestly, is better. And I think we need to be really honest with the person. I'll have these conversations. So when I'm going to be creating your exercise protocol, I will be suggesting this, that, and that. Do you think you can do it? They'll sometimes say yes. No, honestly, do you think you can do it? When will you do the 15 minutes of HIIT? Which day? What time? Actually, I think it's a bit too much at the moment. Okay, we can tweak it, but let's make something realistic. It doesn't have to be perfect, but it has to work for that person. And if it means that it's only a very minor change, like let's take out packet food, let's try and eat a bit more whole foods, or whatever it may be, you can't just throw so many things at a person and expect them to completely change because it becomes overwhelming. And the most important thing about longevity is consistency, right? So if you can't consistently do this, it's just going to fail. And we just need to take small steps.
Well, 100%. I think this is such a huge issue. Also, I think like a lot of people think that you need to do everything all at once, that you need to have perfect sleep, you need to have perfect nutrition, you need to go to the gym, or else it doesn't matter. But this is just not true, as you explained. And also like minor changes, like for example, doing the 1% change a day equals like, I think we all seen this figure, but like 2, 3, 4x change in like a whole year if you do it consistently. Like consistency is just like the single most important factor. And I think like more people need to really understand this. But now I want to go into a topic which is like deep to my heart and which I talk about a lot often, which is like this gap between evidence-based interventions and then experimental territory. So like, where do you draw the line, especially when like the evidence is thin and we also may never see RCTs because the incentives are just not there to do those extremely expensive and complicated RCTs?
I'm quite cautious in my approach, to be quite honest. I don't like to bridge too much away from evidence-based, but I think the way I look at everything basically is risk stratification, risk of not treating versus the risk of treating. So if it's, for example, something like a client who's had a fasting insulin of 20 and they've worked so hard and they've brought it down to 15, but they're not diabetic, should we introduce an SGLT2 inhibitor? Because there is some evidence base that it's really good for overall all-cause mortality, but guidelines in traditional medicine say don't prescribe this, they're not diabetic. We discuss it together and see, this is something I'm going to put you on for the rest of your life. It's not something for a short period of time. These are the side effects, but these are the benefits, and this is what we're hoping to achieve. What do you think? And I think taking a staged approach and looking at it that way is super important. A lot of people are very interested in sort of the peptides at the moment, and I do get a lot of people coming in to say, I'm booking in to get a peptide. And the answer is no. You're not coming to me for a biological molecule. You're coming to me for an assessment. And it's important to be safe. It's really exciting to do dramatic, big, heroic things that make headlines and go viral on Instagram. But what's really important is just consistent, safe medicine. I think that's the most important thing. And there is so much within evidence-based that can improve. You don't have to be making this person live forever, but I mean, just improving their quality of life is a great way to start. So it's not the most fun conversation because a lot of people come with very high expectations and can be a little bit disappointed. But I think being safe is the most important thing.
Yeah, I think so too. I totally agree. I think like being safe is the single most important thing, especially if you are on the trip of trying to optimize your life. If you have some, let's say, minor problems and then you want to optimize, I think maybe the story is a little bit different. If you have like huge complicated problems, no doctor can solve. Like, for example, do you also have clients that went to like, let's say 10, 15 different doctors, all of them told them that there is no issue, that they can't do anything, that they can't find anything, diagnostics point to nowhere pretty much. So how do you handle a situation like this? Do you have clients like this, or do you just don't have any touch points with them?
I do. I have quite a lot, especially in the sort of autoimmune inflammatory space. And a lot of people will come and they'll be like, I've had so much rosacea and eczema and hives and all of this is flaring up. Like, how can you fix this? And I'm just quite honest that, we don't know what's happening. So let's just take a staged approach. I want to create this as a relationship. Let's do as much testing as we can. Let's try things, and things do fail. And we need to just be honest to say that I'm not going to make this better in 6 months. I might not ever make it better, but my aim is to reduce it. And we'll go through a holistic approach. We'll look at your stress, your sleep, your nutrition. What can we do to improve this? But I do see it very often, and I do see people coming in quite overwhelmed and hoping for, a quick fix. But I think it's about just getting them to be a bit patient. But unfortunately, a lot of them aren't so patient, and they'll start something for a few months and then they'll go see another doctor and then go see another doctor and then come tell me, but this doctor told me to do this and this doctor told me to do this. I said, I understand, and it's good to get opinions from everybody and, whoever you're most comfortable with. But I did also tell you this is a 6-month protocol where we're trying to reduce inflammation. It's only been 4 weeks. We're not expecting these massive changes. So you do get a bit of failure when that happens. But all you can do is try and give them as much information and just have open lines of communication.
Yeah, that's really understandable, especially if you, again, the adherence is really a topic again, where you have a different timeline in your own hand and you've communicated it, but then the patient doesn't adhere to it. And then you bring in another variable by adding another doctor. So that's certainly a complicated situation. But it's also maybe something the healthcare system hasn't really been built for, dealing with that level of complexity. Certainly what most healthcare systems haven't been built for is health span optimization. So it's more been historically acute sick care due to infections or injuries or whatever it may be. And now we are obviously on one hand dealing with a whole host of chronic disease. And then on the other hand, we're dealing with people who are healthy or only have minor health issues, and they're really looking for optimization now, but also with regards to their health span and longevity. And my question is, how do you practice longevity medicine within a system that wasn't designed for it?
It's quite challenging because a lot of people think back to old school. I come to somebody, I want a diagnosis straight away and I want a quick fix. But what's really great though is I think the conversation of longevity is a little bit more viral. It's becoming a bit of a buzzword. So people are willing to come in and understand. And I think the first point of call is education into what is preventative medicine. And it's a bit of back and forth. Somebody will come in saying, I've done all my blood, so why do you want to do more? You've done some basic UNEs and FBC and like a basic lipid panel, but we haven't looked at things like erythrogenic particles. We don't have an ApoB or an LP(a). We don't have a fasting insulin. So it's also a bit challenging sometimes explaining to them we need to do a few more biomarkers. That can be more expensive. Say, I did all my bloods for 300 dirhams. Why is your blood test over 1,000 dirhams? It's like because we're looking at different things, and these are clinically actionable. They're very helpful, and they are looking at preventative stuff. We're looking at well before disease comes about. Explaining that can be a bit challenging, but I do take the time to sort of approach that. But I do think at least things are getting better because people are more interested in the field. But I still think that it's a very small proportion of the population that are ready for this kind of medicine, and they're ready to trust it and ready to really make those changes.
Yeah, and this is again where information and education comes into play, right? And how people think about these things, what expectations do they have? But what would you say, aside from the topic we have discussed of consistency and, having more that long-term thinking and how much certain daily habits compound over time, and then you also that you really see in results over time? Aside from the consistency, what's the biggest misconception people have about living longer and healthier?
I think the biggest misconception is actually the definition, because a lot of people still think that longevity is just about living longer. And you do see a lot of viral people out there who say they're going to live forever, and people sort of think our field is just about that. And they don't really understand what health span is. So I think that really still is the biggest issue. And communicating that to them clearly, understanding what age-related diseases are, how do we reduce that, and explaining that all in a very big global matrix, I think is the most important. And also another thing is people think there's a lot of quick fixes, like one IV NAD drip is going to make you biologically longer tomorrow. And understanding that it's just, it's not these dramatic heroic moments. It's quiet. It's just in the baseline. It's little things.
Yeah. This is, I think, such an important topic. I also talk about quite a lot, to be honest, also online, just to make sure that people really get what this field is about. I mean, in general, we don't really have any strict definition on what longevity even is. But I think your notion you pointed towards, that the fact that health span is the thing we want to try to solve for, not lifespan, not to make people live for 200 years, but then suffer for the last 100 years, for example. This is not the goal. The goal is to make people more healthier for longer. And this is really the notion. Yeah, everything around health span. This is the most important thing, which I love. Let's talk a bit about your newsletter as well, because I think it's super interesting. I mean, you look through longevity through an anthropological lens, and maybe even a bit through a poetic lens, which is extremely interesting, and also a very different approach. So what inspired that?
So it's been really fun for me to start the newsletter. It's something I've been really enjoying doing. I think with longevity, everybody's just thinking about the future. What's happening next? What's the future? What's the future? And although it is quite futuristic, we need to look back on the past. How did people live? How did our ancestors live? How did they used to move? How did they used to eat? Then when you start to understand those principles, you also start thinking about what modern life has done to increase the risk of age-related disease. Cardiovascular disease, diabetes. What are the things that have changed, and how do we go back to that? And I think it's so fun, and it's really important to go into it from a very humanistic approach, because at the end of the day, longevity is about somebody's beautiful life. It's not just about biomarkers or charts. It's the body is so beautiful. It's so interesting. It is poetic. It is incredible. We learn things every single day, and it's about optimizing that person's life so they live a longer, happier life. And the joy in that is what's so important. Get it from that full perspective, from looking at the past and how does it translate today? How does it translate to the future is kind of my aim.
Love it. Totally love it. I think this lens is so valuable and so little discussed. Thank you for really putting more emphasis on focus and including this perspective in the whole conversation. I think it's really valuable for people to hear this perspective as well. And also in terms of your newsletter, where you look at it through an anthropological lens and maybe also from an evolutionary perspective, our bodies weren't really designed for the lifestyle we live nowadays, right? So our bodies were designed to live a certain lifestyle, and now because of modern life and all the comfort that comes with it, we are now living a lifestyle very detached from our biology. How specifically do you bridge that gap, and what do you recommend someone that lives in a modern city, in a modern environment, and who wants to optimize their longevity also through this evolutionary perspective in their daily habits and actions?
First thing is actually just going back to circadian rhythm, just simple things like waking up with light and not waking up to your blue light, stress regulation, eating whole foods, basic things like that. And just giving your body biological signals it can trust, and, like light movement gently through the day. And just the thing is, the whole circadian rhythm just isn't just about sleep. It's about insulin sensitivity. It's about how your hormones all interact together. You can't expect to be staying up till 3 a.m. on the weekends and then waking up at 6 a.m. on the weekdays and just expect your body to just switch back. The term is social jet lag, when your body just keeps changing every weekend. So just basically just getting back into rhythm and understanding what that rhythm is and respecting your body's rhythm.
Love that. Totally love that. I think it's social jet lag is certainly something that people, even if they hadn't known the concept before, they can certainly apply it to their own lives, because who doesn't know that you kind of feel maybe a bit hungover on a Monday without even drinking alcohol, purely because you've shifted your rhythm immensely over the weekend, because you went out late and you stayed up late and then you slept in, and now you have a 5-hour gap between your usual wake up time and the wake up time on a Sunday, and all the host of issues that come with it, of feeling tired and maybe brain fog and so on and so forth. Yeah. Thank you for sharing that. Now, as we're heading towards the end of this episode, we would want to hear a few of your perspectives on the future vision and the outlook on the field. And we will do it in a sort of rapid fire questions. So for the next couple of questions, it would be great if you could compress your answer in maybe a 30-second segment. I'm just going to start with the first one, and there's certainly maybe a bit of overlap with what we have already discussed, but just in a way that people can really take it away for their own lives and implement it. So first question, if you could only give someone 3 interventions, 3 things that would move the needle most on their health span, what would they be?
First one would be stop sitting all day. Change your work environment and your home environment. Get like a walking pad at your meetings and get a walking pad where you're watching TV. Second would be get rid of all the junk and just eat whole foods. Everything ultra processed is banned from your house, from your gut. And then I'd say the third would be let's put a curfew on lights. 10 p.m. all artificial lights go off. Let's reset our circadian rhythms. Stop answering emails at 2 a.m. Just let your biology look after itself.
Amazing. So here comes the counterpoint. Like, what are the 3 most overhyped interventions in longevity right now? What should people stop wasting all their money on?
I think the first is doing so much investigation, all this data without making any actionable changes, like wearing all your wearables, doing all your blood tests, but not making any changes after that. I think that's the number one thing that wastes a lot of money. Second would be doing one intervention and expecting a change, like doing an IV drip or taking a biological molecule and expecting everything to sort of change. And then the third is excessive biohacking without changing your fundamentals. Like, there's no point in doing red light and cryotherapy every single day if you're sleeping poorly and eating really poor nutrition.
Great. On the flip side of that, which advanced therapy, intervention, or substance would you bet on that will make headlines in 3 to 5 years?
I think and I hope we'll have personal supplementation at that stage, which based on your biomarkers changes with you as your biomarkers change. And that's one perfect little pill that fixes all the deficiencies you have. I hope it'll be cost effective and scalable. Fingers crossed for that.
Amazing. I hope so too. You're working at the intersection of like longevity sciences, clinical practice, and also public education. So looking ahead 5 years, where do you see the field going? What excites you and what also concerns you about it?
I think what's quite exciting is AI is developing so much. It's going to allow us to be so much more specific, reducing a lot of time in terms of like admin sort of related things and just being a lot more precise. But what I'm worried about is because it's quite a hype, I don't want things to overtake the evidence. Not that we're shooting so far ahead and we don't have the evidence with our protocols. So we do need to be cautious in the field.
Now, the ultimate return on health podcast question that every guest has to answer. If you could change one thing in the current healthcare system, what would it be?
It would be incentives and insurance structures, because right now insurance only values reactive care, diagnoses. You have to fill out insurance forms with all your ICD codes, not optimization. And that brings a lot of barriers to people actually coming in to do a longevity program. If you change that, you change the trajectory, you stop those diseases from even being diagnosed. So I think that's the most important thing.
Dr. Rhea Kotecha, thank you for bringing intellectual honesty to longevity medicine.
Thanks a lot. For everyone listening, like where can they find your work, your newsletter, and connect with you?
So I'm quite active on my Instagram at Dr. Rhea Kotecha, and then my website is drrheakotecha.com. You can contact me there. Thank you so much for having me. I've had a great time chatting with you both.
Thanks so much.
Thank you so much.